Okay, let's talk about when you should start hormone replacement therapy. The studies actually show that for prevention of heart disease, you get the most benefit if you actually start in the perimenopausal or very early menopausal stages. So the perimenopausal stage means that you're still occasionally making estrogen, you're still occasionally having periods, but it's not regular anymore. How to use hormone replacement therapy to feel better, to balance your hormones in perimenopause. If you're not having regular periods, you're not making progesterone. The uterus is not smart. It does whatever the hormones tell it to do. The thing that makes your cycles regular is ovulation. When you ovulate, your body makes progesterone. You don't ovulate, you're not making progesterone. So if your cycles are irregular, it's because you're not ovulating regularly and not making progesterone. A super easy first step for hormone replacement in perimenopause is to make sure that you're getting a monthly supply of progesterone. Now, the issue is because we don't know which cycles you're going to make your own progesterone and which cycles you're not, it gets to be a little tricky. I'm going to be honest with you. You want to work with someone who truly understands hormones and perimenopause and ovulation and the side effects of these hormones and the use of bioidentical hormones, but have a conversation. One of the possibilities would be to go on cyclic progesterone, which means for 2 weeks a month, you take progesterone that will mimic as if your body ovulated. So what this would do is on the months that you don't ovulate, it will regulate your cycles because the progesterone will make the uterus think that you ovulated, make the lining of the uterus stable, and then the withdrawal of the progesterone at the end of the 2 weeks will trigger the withdrawal bleed. Some people feel great using that method and they don't really have low estrogen side effects. So if you're having irregular periods and hot flashes, honestly, I don't think the cyclic progesterone is going to be enough for you. You're going to need to add some estradiol or some estrogen. Now, how do we do that estrogen? On the months that you're cycling and your ovaries are making your own hormones, you might have a little bit higher hormone levels. But honestly, the amount that we give you in hormone replacement is a small percent of what your ovaries actually used to make, especially regarding the estrogen. So having a little extra estrogen on the cycles that your body's making its own probably is not a big deal unless you have gut problems and you can't eliminate your estrogen, which is why you need a whole person approach and to work with someone who understands all this. If you want to learn more about this over time, now's a good time for me to ask you to subscribe because I talk about this stuff regularly and my goal is to empower you to take control of your health. Okay, so if you're using estradiol, we typically give that on a daily basis. In perimenopause, the most natural way to do the progesterone is cycling, meaning 2 weeks on, 2 weeks off. So it requires that you keep track of these things. And if that's going to be hard for you, then it's going to mess up your cycles. Why does it matter if it messes up your cycles? Irregular bleeding would be the result of it. And even though it's most likely due to hormones, the primary symptom of pathology like cancer or precancer of the uterus is irregular bleeding. So if you're having persistent irregular bleeding, your doctor is going to be obligated to work that up to make sure it's not something serious. You can't just say, oh, it's because of your hormones, don't worry about it, because someone could be on hormones and have something serious going on. And if your life is crazy and you can't keep track of where you are in your cycle, number one, we need to talk about why you have such a crazy life because that's a health risk. But number two, perimenopausal hormone replacement therapy probably isn't for you. If you can though, then typically a starting point would be cyclic progesterone, evaluating whether or not you have the hot flashes to consider adding an estradiol patch. A low dose, medium dose estradiol patch is still significantly lower than what your ovaries would make. So on the months that you are making your own estrogen, it's not going to put your levels through the roof, but it will help prevent the hot flashes, help you sleep better. What would your regular doctor recommend? A lot of times, unfortunately, birth control pills. Why is that? It's easy. It's simple. It would take your hot flashes away. It takes the control of your hormones away from your ovaries and puts them in the pill that you take every day. But here's the deal, ladies. It's not natural hormones. It's ethinyl estradiol given orally, which has a much higher risk. It's the oral estrogen that causes your risk of heart attack and stroke. I do not like oral estrogen for women. And then it's not progesterone. It's some form drospirenone, medroxyprogesterone acetate, levonorgestrel, not progesterone. So these are not bioidentical. They don't have the same shape of keys. They're going to trigger other side effects because the shape of the key is different. And I truly believe if it's available in the form that God made it, that's the way you should take it. So bioidentical hormones is important. The only time, side note, that I do recommend recommend birth control pills is when an unplanned pregnancy would be devastating. We're not talking about that. We're talking about perimenopausal hormone replacement therapy. One thing you need to know, if you're perimenopausal, fertility is a potential. So you must be aware of that. Don't assume because your periods are irregular that you absolutely can't get pregnant. Is it unlikely? Yes, but it's not impossible. And so that's another reason why a lot of OBGYNs are recommending birth control pills, because then we take away the question of needing reliable birth control during the perimenopausal period. Have the discussion, evaluate your symptoms. One more hormone that can be off, and it can be off no matter where you are in your fertility years or postmenopausal, is testosterone. This is completely understudied in women, completely misunderstood, but you should have your testosterone levels checked, and especially your free testosterone, because that's what matters. If you struggle with fatigue, low libido, difficulty making decisions, you feel hyper emotional, those are all symptoms of low testosterone, and that can happen anywhere in your reproductive years. It is definitely worth getting evaluated and have your levels checked. Lastly, please make sure you have working receptors. I'm the hormone locksmith. We concentrate on both hormones and the receptors. The hormones are the keys. The receptors are the locks. You need both to be your best, and I want you to be your best. If you have found this helpful, please send it to someone that you think needs to hear it. Thank you.